Hi, my name is Dr. Michael McKinley from Progressive Physical Therapy and Rehabilitation. One question we get a lot of is, what is plantar fasciitis and how do you treat it? So the plantar fascia is a unique tissue because it's not a muscle, right? So it's not contracting like you would think of a normal muscle like your bicep or something. And so here's a model of a foot. The plantar fascia actually attaches to our heel and comes across, creating our primary arch in our foot. So it's a piece of connective tissue that acts more like a spring. And so when the pressure is off of it, that spring or that plantar fascia gets tight, creating our arch. And then when we hit the ground and our foot flattens out, then the plantar fascia will stretch, help absorbing weight, and protects the joints of our midfoot. So a lot of times people will get plantar fasciitis for a variety of reasons. And one of them is maybe we're a little bit sedentary and we decide we're going to start a walking program, or maybe we're a walker and we decide that we're going to start running. In other words, we increase our activity level. Plantar fasciitis is very common. And what it will feel like is a tightness, a burn underneath the foot in the arch. So most people try to rub it out or they try to stretch it out, but that's really not what we want to focus on. A lot of times plantar fasciitis comes from an increase in our activity level. So maybe it's a modification of activity level. A lot of times it's a tight calf. And the calf gets so tight that it actually puts extra pressure on the plantar fascia when we go down because we can't kind of arch or step into it. So keeping our calf flexible is a good way to take pressure off the plantar fascia. A lot of times people will get an over-the-counter orthotic, which is another good thing you can try because that props up that plantar fascia and takes pressure off of it. But sometimes when you get an over-the-counter orthotic, when the plantar fascia is already irritated and it pushes up, it only makes things worse. And what happens a lot of times, which sometimes even a podiatrist can miss, is there's a bone on the top of your foot, and it's called your cuboid. And your cuboid can actually slide down. So if you imagine your plantar fascia is like this, that cuboid pushes down into your plantar fascia, and it gets stuck there, always pushing down. So every time you step on the ground, pressure goes up, the cuboid pushes down, and that can create a very severe plantar fasciitis that doesn't seem to go away with anything, rest, ice, or an orthotic. What a physical therapist can do is actually get that cuboid and put it back into neutral, taking that downward pressure of that bone, relieving the stress off your plantar fascia, and then thus your plantar fascia will start to improve. So if you have a plantar fasciitis pain and you don't know where it's coming from, try rest, that's fine, but you can also call your physical therapist, and a lot of times we can evaluate to figure out where it's coming from. So if you need us, give us a call. More information is available online at progressiveptandrehab.com.